Addiction. The word itself conjures images of wasted lives, lost potential, and moral failings. We often view addiction as a personal weakness, a lack of willpower, or a choice made with disregard for consequences. But this view is dangerously incomplete. It prevents us from seeing the true nature of addiction and hinders our ability to offer effective help. Addiction is not a character flaw. It is not about a lack of willpower or a desire to inflict harm. At its core, addiction is a response to pain, a desperate attempt to cope with overwhelming emotional distress. People struggling with addiction are not bad, they are in pain. They turn to substances or behaviors not out of malice or hedonism, but as a way to numb, escape, or find temporary relief from their inner turmoil. To truly understand addiction, we must shift our focus from the outward manifestation of the problem to the underlying pain that fuels it. What kind of pain drives people to addiction? It can stem from various sources, but trauma often plays a significant role. Traumatic experiences such as abuse, neglect, or violence leave deep emotional wounds. These wounds, if left unaddressed, can fester and manifest as anxiety, depression, PTSD, and other mental health challenges. For many, addiction becomes a way to cope with these unhealed wounds. Substances or addictive behaviors offer a temporary escape from the pain, a way to numb the intensity of their emotions, or a sense of control in a world that feels chaotic and overwhelming. When we think of addiction, drugs and alcohol often come to mind. However, addiction extends far beyond substances. It can manifest in various forms, including gambling, shopping, gaming, sex, work, and even exercise. The common thread across all forms of addiction is not the object or behavior itself, but the underlying emotional distress and the desperate attempt to find relief. Whether someone is addicted to heroin or gambling, the root cause often lies in unprocessed pain and a lack of healthy coping mechanisms. Traditional approaches to addiction often focus on punishment and blame. We shame individuals, isolate them, and treat them as criminals rather than people in need of help. This punitive approach is not only ineffective but also deeply harmful. It perpetuates stigma, prevents people from seeking help, and exacerbates the cycle of addiction. To truly address addiction, we need a paradigm shift. We need to move away from judgment and punishment towards understanding and compassion. This means creating a supportive environment where people feel safe to confront their pain, develop healthy coping mechanisms, and heal from the inside out. Recovery is possible, but it requires empathy, support, and a belief in the inherent worth of every individual, regardless of their struggles.